All right, so we have three main functions for the lymphatic system. The lymphatic system provides the route for return for extracellular fluid to the circulatory system. It acts as a drain off for inflammatory responses, and it actually renders surveillance, recognition, and protection against foreign materials through a system of lymphocytes, phagocytes, and antibodies. So the lymphatic system is very important. Of course, I know I say very important a lot, right? Everything's very important. The lymphatic system is a collection of different structures throughout our body that transport special fluid, otherwise known as lymph fluid, through an increasingly larger system of vessels and filters. The main components are the lymph nodes, lymph vessels, and the spleen. Lymphatics run right next to cardiovascular, so if you have a blood vessel, then you're going to have a lymph vessel really closely associated with that. The cardiovascular system is kind of like a transport system. It's like the highways you deliver things to where they need to go. It's more like the sewage system for the lymphatic system. Cardiovascular is the transport. It's the highways and the byways. You're delivering things and picking things up. Lymphatics is our sewer system. We're getting rid of all the junk that we don't want. So next to our roads, right, and especially where I grew up in southern Louisiana, we had these big ditches next to the roads to catch all of the water because it rained a lot. So next to the roads, we had ditches and pipes for drainage, and those drained sewage towards one direction, towards that sewage treatment plant to get rid of it. It drains the excessive interstitial fluids away from the cells and passes that fluid through the lymph nodes. Lymph nodes are like small checkpoints in your body that scan that lymph for the presence of foreign substances, pathogens, or toxins. So it could kind of be like a filter in different sections of these pipes, right, to keep larger things in or out. We also have the surveillance, right? So this is our CIA, surveillance, recognition, and protection. That's our white blood cells, our immune system. These white blood cells, a component of our immune system anyway, recognize those foreign substances in the lymph, then that lymph node will swell up. If lymph passes through and is clear, then it's just going to circulate on back to your blood. So this shows the lymphatic pathways and how they correlate to the cardiovascular system and the capillaries. And you can see you have systemic capillaries, and then you have some lymphatics here, lymphatic capillaries, lymph nodes in between. The smallest of the lymph vessels are called lacteals, and these are lymphatic capillaries. They drain fluid away from the tissues into your larger lymph vessels that go to the lymphatic trunks that drain into the venous system and then eventually becomes part of plasma. Lymphatic vessels are they're similar, but yet they're thinner than those of veins. Lymph vessels have valves in them. These are one-way shut-off valves that prevent fluid from backing up into the lymph vessel. If they're damaged, we can have lymph congestion, and that leads to edema in tissues. Lymphatic vessels are made of three different layers. You have the inner endothelial lining, the smooth muscle layer in the middle, and the outer, tougher connective tissue. And so larger vessels lead to lymph nodes, which then lead on to larger lymphatic trunks. Muscle contraction can actually help move lymph through lymphatic vessels. So remember, the lymphatic system parallels the cardiovascular system. The trunk that drains the fluid back into the cardiovascular system, those trunks are going to serve lumbar, interstitial, intercostal, things like the bronchomediastinal, subclavian, jugular, the thoracic and right lymphatic duct are then going to drain the lymphatic trunks. Lymphatic vessels are going to merge into larger trunks, which in turn drain into what we call a collecting duct. So here we see the right lymphatic duct is going to drain. Here's the right lymphatic duct here. It's going to drain from the upper right side of the body, and then we're going to have the thoracic duct here that drains from the rest of the body. All right. And on the right side here, we've got lymph drainage from the breast, illustrating a localized function of the lymphatic system. Surgery to remove a cancerous breast can actually disrupt this drainage and cause some painful swelling. This shows the path of drainage, and basically everything drains back to the subclavian vein eventually, okay? This is true for both the right and left side. So what is lymph? Well, lymph is really just basically tissue fluid that is entered into a lymphatic capillary. Okay, so formation of lymph just basically depends on the tissue, the fluids that are coming from the tissue. You can kind of basically think of lymph as just basically plasma. You cannot go and just pierce a lymph node and expect it to drain. If you have a lot of lymphatic congestion and edema, you're going to have to massage some of the fluid out after scraping the skin off a little bit. And you'll see a lot of videos sometimes where people actually massage some of their lymph glands as well here to encourage flow to occur. So edema is the accumulation of tissue fluid in interstitial spaces. This occurs when things are not flowing correctly. So filtration from the plasma of lymph normally exceeds reabsorption, which leads to the net formation of tissue fluid. This increases the tissue fluid's hydrostatic pressure within those interstitial spaces and forces that fluid into the capillaries, forming lymph. And this, of course, prevents that accumulation of edema. So when this process is not working right, this is where we get some of the formation of edema. So signs of that swelling or edema and problems is increasing in size, and then those tissue pits, the pitting edema. You can put your finger into it and it actually holds its shape like it's poking your finger into bread dough, and that actually stays there for longer than a few seconds, all right? These are adapted to receive proteins, foreign particles in a way that blood capillaries just can't do. Tissue enters lymphatic capillaries through flap-like valves found between the epithelial cells, and they deliver those foreign particles to the lymph nodes, excess fluids, and collect the excess fluid from the interstitial fluids and also fat. Lymph has a low hydrostatic pressure, so it needs muscles to help it move through. So muscle contraction compresses vessels, squeezing the lymph through. Valves prevent backflow, so it's going to move towards that collecting duct. All right, so let's look at the structure of a lymph node. We have the hilum. Hilum is the region of a lymph node through which the blood vessels and nerves pass. Study this particular diagram in your textbook. It is important. Lymph nodes have afferent vessels which lead the fluid in. The fluid passes through the small, what we call germinal centers here. Those are the germinal centers. You can see they're kind of round looking. These are full of B lymphocytes, and these guys have IgG antibodies that are going to bind to a foreign substance and make memory B cells. So that's important for immune system. They recognize something as foreign. In our body, we have self cells and we have non-self cells. So our body recognizes when it's functioning correctly what's supposed to be there and what's not supposed to be there. And so these can recognize something as foreign and react to it again much quicker after they make a memory cell. So it's basically a way to scan the fluids that are in your body. So once it's scanned, it's going to pass through an efferent vessel, which is located near the hilum. All right, so you're going to have your efferent vessel here once it scans. A hilum is just an area in general where vessels can enter and exit an organ. So you see this in other places as well. It's not just here. And this is eventually going to drain to the subclavian vein. Lymph nodes and lymph glands are located all along the lymphatic pathways. They contain lymphocytes and macrophages to fight invading pathogens. Macrophages are also found in the lymph nodes when we call them phagocytes. So they're going to phagocytize, remember, cell eating. And these consume foreign substances, which is, of course, a vital role in the immune system. Lymph nodes also consist of compartments that have little masses of lymphocytes and macrophages, afferent vessels circulating lymph into the node on the convex surface, and the lymph nodules. Macrophages engulf and destroy damaged cells, foreign substances, and other cellular debris. Lymphocytes and macrophages are what are primarily responsible here for immunity. So if I asked you where lymph nodes were found in the body, you could probably tell me that there are some found here. But that is not the only place that they're found. They're found all over the place. So we have cervical lymph nodes that drain the face, scalp, and skin here. You also have some back here. They come up here. You can look in this diagram and see them. We have the axillary lymph node. Now you could tell me you have one there. Those drain upper limbs, wall of the thorax, mammary glands, and the upper wall of the abdomen. Then we have the supratrochlear region, which is going to be near the elbow, and that often gets inflamed due to cuts and scrapes on things like the hands. You can see that's here. Here's the axillary, cervical. We also have the inguinal region, which drains the lower limbs, external genitalia, and lower abdomen. And the pelvic cavity is going to drain the pelvic viscera, some in the abdominal cavity to drain the abdominal viscera, and the thoracic cavity, you'll find some for the thoracic viscera and inner thorax. Lymph nodes have two primary functions: filtering potential harmful particles out of the lymph from the lymph, and then act as that immune surveillance, or the CIA, provided by macrophages and lymphocytes. Along with the red bone marrow, the lymph nodes are going to be the center for lymphocyte production. The thymus and the spleen are the two other lymph organs with functions similar to those as lymph nodes. A primary immune response is going to produce antibodies within 5 to 10 days. You can't see my hands, can you? 5 to 10 days of exposure to an antigen. This will produce antibodies within a day or two of a subsequent exposure of the same antigen. An antigen is basically any foreign particle that is non-self. So this can be a microorganism or it can be pollen. All right, anything that is non-self to which a lymphocyte will respond. A globular protein that is a lymphocyte is a globular protein that reacts with an antigen to eliminate the antigen, to get rid of it, get it out of our body. Lymph nodes have two primary functions: filtering potential harmful particles out of the lymph from the lymph, and then act as that immune surveillance, or the CIA, provided by macrophages and lymphocytes. Along with the red bone marrow, the lymph nodes are going to be the center for lymphocyte production. The thymus and the spleen are the two other lymph organs with functions similar to those as lymph nodes. A primary immune response is going to produce antibodies within 5 to 10 days. You can't see my hands, can you? 5 to 10 days of exposure to an antigen. This will produce antibodies within a day or two of a subsequent exposure of the same antigen. An antigen is basically any foreign particle that is non-self. So this can be a microorganism or it can be pollen. All right, anything that is non-self to which a lymphocyte will respond. A globular protein that is a lymphocyte is a globular protein that reacts with an antigen to eliminate the antigen, to get rid of it, get it out of our body. So the thymus is actually larger in infancy and decreases. It's smaller in an adult, and in the elderly, it's eventually replaced by fat and connective tissue. This is where the lymphocytes are located. It functions to secrete protein hormones that are called thymosins, and those stimulate T lymphocytes to mature. The spleen actually functions like a really big lymph node. It's the largest lymphatic organ and is located in the upper left abdominal quadrant. It has sinuses filled with blood. It has what we call white blood pulp, which is the lymphocytes, and red pulp, which is the red blood cells, okay, and the macrophages. And its main function is to filter blood. It does have lymphatic nodes in it, but it does a lot more. It functions to dispose of abnormal red blood cells in the body. So if you have a disease that makes your red blood cells abnormal, say something like malaria, which is caused by the protozoan Plasmodium falciparum, this actually infects your red blood cells, and so you'll see splenic enlargement as a symptom of this. Mononucleosis is another. And so this is why you can actually be at risk for a splenic rupture with a disease like this, because of the splenic enlargement. So if it ruptures, it's full of blood and you can bleed out very, very quickly. So very important to look for this symptom with these particular diseases.